Hi, I'm Dr. Aman Gupta. I'm a urologist, andrologist, and kidney transplant surgeon at Fortis Hospital, New Delhi, India. We are going to discuss about cancer prostate. Prostate is an organ which is present in all the men. It is responsible for producing semen in men. After the age of 50 years, many men would have some degree of prostate issues. The prostate gets enlarged because of changes of hormones in the body, and it can cause either benign or which is non-cancerous enlargement of prostate or cancerous enlargement of prostate. Symptoms of non-cancerous prostate and cancer of prostate are the same. What are those symptoms? The urine flow will reduce. A person has to strain while passing urine. There can be some pain while passing urine. After passing urine, a person feels that he is not able to empty the bladder completely. There may be a frequent urge to pass urine. Sometimes there can be some blood in the urine or burning in the urine. In further advanced cases, the urine can stop altogether. And in some very advanced cases where the cancer has gone outside the prostate, it can lead to pain in the bones, back pain, swelling in the legs, or sometimes even paralysis of the legs also. Now, how do we diagnose whether a person has cancerous or non-cancerous enlargement of the prostate? So most important is a blood test called as PSA. PSA means prostate specific antigen. It is a chemical which is produced by the prostate and released into the bloodstream. By doing this test, PSA, we can ascertain what are the values of that hormone in the body. If the values of PSA are more than 4, then it is an abnormal finding, and then there are two causes of these values. One can be either there can be some infection of the prostate, and other possibility is cancer of the prostate. So based on clinical examination and further testing, a urologist will ascertain whether you have infection or you have cancer of the prostate. Next test is called as digital rectal examination. What does it mean? The urologist puts a finger through your anus to feel the prostate. What is the consistency of the prostate? Is there any abnormal nodule or abnormal hardness on the prostate? One can ascertain if there is something abnormal about the prostate. Lastly, there are some other scans like MRI scan and prostate biopsy. MRI scan can give some indication whether there are some harmful changes in the prostate or not. However, that is not confirmatory. The only confirmatory test for cancer prostate is prostate biopsy. How it is done? The urologist inserts an ultrasound probe through your rectum and visualizes the prostate. From that ultrasound probe, we pass a biopsy needle through which very small tissues of the prostate are taken out and sent for examination under the microscope. This test is generally ready between 3 to 7 days, and that is the confirmatory finding whether you have a prostate cancer or not. Once the prostate cancer is done, we have to find out what is the stage of prostate cancer. This staging can be done by various methods. One of them is what are the values of PSA. Number two, the final histopathological biopsy report of that prostate cancer. And finally, a scan called as PSMA PET scan. PSMA PET scan mentions and shows whether the prostate cancer has gone out of the prostate into other organs or not. Bones is the commonest site, followed by lymph nodes of the lower abdominal area where the prostate cancer can spread into. Now, what are the treatment options? Fortunately, prostate cancer is a very easy cancer to treat provided it is diagnosed at a very early stage. If it is diagnosed at an early stage, the treatment options are radical prostatectomy. What is radical prostatectomy? The whole of the prostate is removed. That is best done by a procedure called as robotic radical prostatectomy. This can also be done by laparoscopic methods and open methods. However, robotic surgery is the best method because recovery is very fast. The prostate can be removed by making very small tiny holes on the body. The blood loss is minimal. There are very less chances of incontinence of urine, which means the lack of control of urination, and there are lesser chances of losing your erection potential. The recovery is fast and you can be discharged from the hospital quite early and you can recover very fast from this procedure. Other methods are laparoscopic method and very rarely open surgery is performed. Apart from this, somebody who is not fit to undergo a procedure, he may also be offered radiation therapy. Radiation therapy is also an advanced modality. Nowadays, very advanced machines are available through which results are very good. In cases where the prostate cancer is advanced, the other options are radiation therapy along with hormonal therapy. What is hormonal therapy? The prostate cancer derives its food from male hormone called as testosterone. If we remove the testosterone from the body, the growth of prostate cancer will slow down. This can be done by two methods, either by giving you some tablets and injections or by removing your testicles surgically. Apart from this, if the urine flow is very less, your surgeon can do something called as channel TURP, which means passing a camera through the urine passage and making a passage in the prostate area so that your urine flow can be normal and you can pass urine smoothly. In very advanced cases where it has gone outside the prostate into the bones or other organs of the body, you may be given an option of chemotherapy also. Most of these treatments give good results, especially if the prostate cancer is diagnosed at a very early stage. The best way to diagnose prostate cancer at an early stage is it is recommended that after the age of 50 years, you must undergo a test called as PSA every year, along with digital rectal examination by a urologist. If you have a positive family history of prostate cancer, which means somebody in your family, like your brother or your father or your uncle had prostate cancer, then you have higher chances of getting prostate cancer. So you should start screening at the age of 45 years and above. As far as the prevention is concerned, you must lead a healthy lifestyle. You should stop smoking. You should maintain ideal body weight, and you should reduce intake of meat products. And you must go for an annual health checkup. So, if prostate cancer is diagnosed at an early stage, it is very easy to treat and the outcomes are excellent. Thank you so much.